In anatomical position, the radius is distal and lateral in relation to the ulna and to the rest of the body. And this is the diaphysis of the forearm, and it appears fractured in the x-ray. The distal epiphysis of the radius serves as a growth plate for the wrist, especially in a 6-year-old, and then the proximal epiphysis aids in connecting to the elbow.
This x-ray does match a 6-year-old because the epiphyseal line in the bone is not completely filled and it's kind of faded, so there's like still room for growth.
The periosteum wraps around the outside of the long bone. The compact bone is on the inside of the periosteum, and the spongy bone is, if this is cut in half, is on the inside of this, and there's like this layer of there's a layer of compact bone around the spongy bone. The spongy bone's on the inside. Connecting the periosteum to the bone is the Sharpey's fibers, so in between the compact bone and then the periosteum, there's this Sharpey fiber. The medullary cavity is where the red and yellow bone marrow lies, except because this is a 6-year-old, there's mostly red bone marrow and some yellow because they're still growing.
So the bone is made up of smaller units called osteons. Within the osteons are the Haversian canals, which the blood vessels and the nerves are able to go through the bone. So the osteon have rings called lamellae, and within the lamellae are the lacunae, which are like little pockets for the osteocytes. So collagen fibers within the bone form a matrix, and this matrix helps with the flexibility and the framework of the bone. Hydroxyapatite is formed within the matrix, and it aids in bone formation and strength. Without proper levels of calcium and collagen in the bones are more susceptible to break and not growing.
The cellular process of remodeling begins when osteoblasts and osteoclast cells fuse from a multinucleated osteoclastic cell. Once the fusion of osteoblasts and osteoclastic precursors has occurred, the resulting osteoclast attaches to the bone surface and commences resorption. PTH is a polypeptide hormone secreted by the chief cells of the parathyroid glands, which acts to raise calcium levels in the bloodstream. Calcitin, a polypeptide hormone, is released from thyroid T cells in response to elevated calcium levels. Calcitin binds to calcitin receptors on osteoclasts to inhibit bone resorption. An increase in loading will cause the architecture of the internal spongy bone to strengthen, followed by strengthening of the chordal layer. Our bones become thicker and stronger over time to resist forces placed upon.
In healing the bone, first the tissue around it forms back. So if it's broken here, then the tissue around it will form back, and then it turns into like a soft. Through the inside, it just turns into like cartilage on the inside and just soft, basically. And then it gets harder, but starting from like the outside in, spongy bone forms, and then at the end of the process, the spongy bone turns to compact bone and it smooths out